Hello and welcome to another exciting time on Wellbeing. How are you doing? I trust you're having a wonderful time. I want to use this opportunity to say a big shout out to the Super Eagles. Those guys did very well. And of course, one of the things we talk about in well-being is our mental health. I know that some of us, our mental health was shady yesterday, but fear not. We are good, we are strong, and we give our very best. This is Wellbeing. On today's show. We are still talking about the eyes. And if you missed our first edition, you have to go to our social media page, that's Spectrum TV Live, and catch up with the first edition of this. This is like the part 2 of last week's edition, and we are still talking about the eyes. But before I go further, I would like to read this thing to you. Now, according to World Health Organization, vision impairment remains a major global public health concern. At least it is estimated that 2.2 billion people worldwide are living with near or distant vision impairment, and alarmingly, over 1 billion of these cases could have been prevented or are yet to be properly addressed. Now, globally, the leading cause of vision impairments and blindness are uncorrected refractive errors and cataracts, conditions that are often treatable when detected early. Now, however, access to care remains limited. Now, while vision loss can occur at any age, it disproportionately affects older adults, with the majority of people living with vision impairment or blindness being 50 years and above. On today's episode on well-being, we'll be focusing on the eyes, the importance, the overall well-being. We'll look at the myths and also eye infection that most times you see and you ignore. So I would advise you pick your pen and your diary, because in the next 25 minutes you are going to learn about the eyes, and I wish above all things that you will take what you learn into practice. Don't go nowhere. This is Wellbeing on Spectrum TV. We'll be right back. So last week we talked about the eyes, what is the eyes, and how to take care of the eyes. Today we are going to talk to Dr. Felicity Jimmy, an optometrist, that's an eye doctor, and she's going to tell us some of the eye infections that most times you see but you take for granted or ignore, and sometimes it could lead to a very serious eye problem. So over to you now, Dr. Felicity Jimmy.
Wearing glasses, people selling glasses. Talking about most infections that are common, where people normally experience. Number one is conjunctivitis. Conjunctivitis, can call it pink eye. You can see some people wake up in the morning, they realize that the eye is red, is tearing, is bringing out discharge. So conjunctivitis is the first form of infection that is very, very common to almost everybody, that even a child can also get it, and it's mostly due to number one, poor hygiene. Then under that conjunctivitis, you can see something like bacterial conjunctivitis, fungal conjunctivitis. Now, bacterial conjunctivitis is mostly gotten from bacterial infection. Then while those of fungal mostly gotten from fungi, people that work in farm, the leaf of either the leaf or anything can come in contact with their eye during their farming season, and that particular form of infection is mostly common during farming season. Then you can see the one that we call venal conjunctivitis. Venal conjunctivitis is mostly seen in children. It's an eye infection that is mostly common among children. Then you can get to see other forms of conjunctivitis like I've mentioned fungal, I've mentioned bacterial, venal conjunctivitis. I think that's enough, I think, for this purpose. So when I talk about venal conjunctivitis, it's a form of conjunctivitis that is mostly seen in children, whereby a child can wake up with tearing, discharge, and you change the nature of the discharge. It's kind of stringy. It's looking like a string. And also sometimes the anterior part of the eye, which is the cornea, is also affected. Is also involved. It's a form of infection. It's a form of conjunctivitis, but it's mostly seen in children. All of them have their own definitive features, but there are things that you look out for to rule out, to know the type that the child is experiencing. All right, so that's vernal conjunctivitis. Let's talk about cataract. Okay, cataract is cloudiness of the lens. Is an age-related eye problem that is only seen, mostly seen in elderly people, and that is because the lens inside the eye over time has changed its color, it's becoming weaker and everything. So this cataract we talk about, once I go out to educate people on cataract, people do not really know that cataract is a simple, is like say, is not so a major problem, in that it has a solution. Is when the lens inside the eye is cloudy, it can no longer give you a clear vision. Like the other time when I explained in parts of the eye, I said that the lens in the eye is a clear glass, is a crystal clear glass in the human eye, which enables light to pass through to get to the retina. So over time, as people are aging, the color of the lens changes, the lens itself also changes because it's a glass. So when this lens changes in color, things will no longer appear clearer how they used to be. Because imagine you having a mirror that you've not dusted for a long time, you cannot use that mirror. So that's what happens in cataract. Once the lens becomes cloudy, everything will also appear like harmattan for the person. So that's what we call cataract. And the solution to cataract is operation. That's the only solution. So some people do not really know that cataract can be operated on, or some people have the fear. I don't tell patients this should be the least thing that should bother you, except and otherwise your retina is affected and you do not know. But if it's only cataract, you have no problem, you have no cause to fear for your operation. Once you take it off and it's replaced with a clear glass, you begin to see like a newborn baby. And cataract is prevented. Yes, cataract can be prevented. At the same time, there are some things we cannot prevent. If it's due to aging, it can actually be prevented because aging is inevitable. Just like I tell patients, the same way you cannot stop your skin from wrinkling, the same way you cannot stop your gray hair. All those changes that takes place in the human body also takes place in the eye. But for other people, yes, it actually protects your eye from developing cataract light, always using your protective glasses, not exposing your eyes to sunlight. You get. So these are the things. Another thing is this: there are other health conditions that will trigger cataract to develop, especially people that are hypertensive and diabetic. They always have higher chances of developing cataract because diabetes has impact on the lens. Same thing with hypertension.
You see, so the eye is very, very important. And if you don't take care of your eyes, you could lead to diabetes, or it could lead to, what's the last one that you mentioned? Eye infection, and that could be very, very bad. Earlier, you mentioned lens. Yeah, I heard her talk about lens, wearing protective lens to help you. Now, most times you see people who want to put on a lens and they could just walk into anywhere and then just buy a lens and wear. So let's ask Dr. Jimmy, how do I know the right types of lens to buy, and what are the dangers of just, buying lens anywhere to use on my eyes?
In a world where we have a lot of people wearing glasses, people selling glasses, even by the roadside, online, well, I would say that the best thing you can do for yourself is to protect your eye. Do not just allow anybody or any person who is not a professional to recommend glasses for you. You can't just take, if you just walk into any shop and I say, okay, get these glasses and wear, it means that you're not even serious with your sight. Because it's only a professional that after evaluation, doing a comprehensive checkup for you, that will now tell you, okay, master, you need glasses or you do not need glasses. So we need to protect our eyes because a lot of people now are really into capri. There are lots of capri in the world that even by plaza, you can see people selling glasses, selling different forms of glasses. And I always tell people that before you get glasses to wear, have you been examined? It's not just about the glasses, but when you meet an eye doctor will do a proper checkup for you to know if there are other underlying conditions that you might not know. I've seen a lot of patients that when they come to get their glasses, they just say, okay, doctor, I'm here to get glasses for reading. But we can't just, as a professional, I can't just rush into prescribing glasses for that person. It's by virtue of my profession, I must do a comprehensive checkup for that person, not just limited to glasses. Because there are some conditions that once it's tried, the glasses they are looking for will no longer help or cannot help. So it is pertinent that people use the right track for their health care. It's not just about the eye, even on your human body. Don't just go to any person, then take something from the person, then you swallow it into your system. It's not ideal. It's not even safe. It's not a safe practice.
So you see that you cannot just walk up to anybody and get lens. Like the lens I'm wearing right now, trust me, it was recommended. So next time you decide to wear lens, whether for beauty purpose, at least talk to an optometrist. And guess what? It's not that expensive. It's better for you to talk to someone and get the right thing done than for you to just look cute one day and spend your 50 years with a walking stick. God forbid, in Jesus' name, like we say in Nigeria. Anyway, some people complain about burning sensation. Sometimes you hear people say, I woke up and I felt sun inside my eyes. I woke up and my eye was red. Most times people say that, oh, I woke up with a full eyes. That's because I ate rice the previous day. If someone wakes up with these symptoms, how should they go about it?
Burning sensation, headache, and blurry vision. Sensation is mostly caused by stress. When the eye is tired, when you are tired, stress can cause burning sensation. The another thing that can cause burning sensation is dry eye. What is dry eye? Dry eye is a situation whereby the tear film is not producing enough tears to lubricants to lubricate your eye. So some people, you can see people, someone exposes his eye Monday to Sunday, year to year, without any form of checkup. Imagine someone that is always on screen. That person is prone to experiencing dry eye. Yes, and then there are some people that naturally that their tear quantity is kind of poor. So this one person is have higher chances of experiencing dry eye. And once you have dry eye, one of the common symptoms is burning sensation and even itching. Yes. The other one that people can wake up with severe headache that affects vision. Okay, one of the interesting case I had, which I post on social media, was a young couple who had severe one-sided headache. So this headache was so persistent that even when she was on pain relief medication, she wasn't okay. So when she came for eye checkup, someone recommended her to us. When she came for eye checkup, I did a full examination for her, and when I checked the pressure of that eye, the eye pressure was 80 millimeter mercury, when the normal eye pressure is 10 to 20. So the affected part of the head that she had the headache, the pressure there was 80, while the other side was 11. So things like this can also cause severe frontal headache. So I used to tell people, it's not all headaches that are is what you just need to take pain relief. Some of them has to do with your eye. The eye is located on the head, and the head controls all the activities of human being. So anything that affects your body will always manifest in your eye. So for phone, the eye, and the screen, that is what we call computer vision syndrome, CVS. Computer vision syndrome is an eye problem, or let's say a condition in which people who are exposed to so much light from phone, screen, sun, even car headlights tend to experience either frontal headache or dryness in the eye, that anytime they are using their phone, they feel they feel a form of eye strain. They easily get tired. So that is computer vision syndrome. So in the case of computer vision syndrome, you can either reduce your screen time, reduce the amount of time you spend on screen. And if it demands that the work that you do cannot permit you to stay away from screen, then there's what we call rule 20-20-20, then blink. In rule 20-20-20, it's mostly recommended for people that spend much time on screen. It simply means that for every 20 minutes you spend on your screen, you look away at 20 feet for at least 20 seconds, so that the eye can be at rest, and also curtail the amount of light that enters the eye. And if anybody get that, for example, if this is my laptop, if I'm operating on my laptop all day long, Rule 20 simply says that for every 20 minutes I work with this system, I should look at 20 feet away from the system, or at least 20 seconds, then come back again and continue my work. By so doing, I'll be able to control my digital eye strain. So
Of your work, you may not really have that ample time like some people are complaining, but I mean few seconds is still enough. You can't say, oh, because I work in a you can't say that, oh, because I work in a TV station, that's why, I came down with eye problem. And most times, most eye problem, will mostly show up in your 40s, 50s. So in your 20s, how you take care of your eyes in your 20s, your 30s will determine how your eyes will turn out to be when you are turning 50 or 60. So intentionally, at least not when I'm doing my program, but intentionally step away from the screen for your own benefit. Okay, right about now, let's talk about self-medication. Most times people just say, oh, my eye is red. Let me get an eye drop. I won't even lie. I've done that before. But thank God for, his mercies are new every morning. But let's look at the side effects of self-medication when it comes to the eye. How bad is it? Is it okay for me to just pick an eye drop anywhere and then get going?
let's talk about the dangers of self-medication, especially eye drop. Self-medication is never a practice that should be encouraged, because for every medication has its purpose. It has its own contraindication. It has people that are meant for this particular medication, and there are people that are not meant to use this medication. It also has what we call adverse effects. For every medication, there's an adverse effect, in that before you recommend any medication for anybody, you must have evaluate the person's medical history to know if the person is fit for this medication. So in the case of self-medication, you can't just go to a pharmacy, then buy drug and start using. Do you know if you are fit to use that medication? Do you know the contraindication? Do you know the people who are not advised to use this medication? So self-medication can cost you your sight. And if you are under self-medication, you cannot even tell the proper dose that what you are treating yourself for should be used. For example, you cannot have someone who is having severe infection, and you recommend an antibiotics for the person to use maybe once in a day or twice daily. You must have known the severity of a condition to guide you in the doses you are going to administer to someone. So you using self-administered medication is not ideal, because number one, you are not even sure if you are using the right medication. All eye drops are not all eye drops. For example, if you come to infection, there are different forms of medication that you use. If you are going to go for antibiotics, antifungal, antiviral, depending on the cause of the infection that you are treating. You cannot be having viral infection and just go to pharmacy and get gentamicin. All eye drops are not eye drops. You cannot use antibiotics to treat antifungal infection. Neither can you use antiviral medication to treat for antibacterial infection, bacterial infection rather. So every medication has its purpose and use. So it is not advisable that once you have any form of infection, you just go to pharmacy and get the medication and use. Please. Can eye problems be treated early? I would say no. Eye problems cannot be treated early because it is not ideal. Every herbal medication is already synthesized in form of eye drop. It is controlled. A raw herbal medication that you use on the eye can be very toxic to the eye. It's not that the herbal medication is bad. You get? Of course, people even use eye drop, but if it's not the right choice of medication, they can react to it. So herbal medications are not always advisable for the eye, reason being that they can be very, very toxic to the eye. And for every medication, especially when it comes to eye drop, the first part of once you instill your medication, the medication will come in contact with a part of the eye that we call cornea. Cornea is a transparent front part of the eye and is very, very sensitive. So anything that is herbal, once it comes in contact with the cornea, can melt it off. So once it melts off the cornea, the eye will ultimately becomes infected, and of course that eye is gone. So that's why we do not recommend people to go for herbal medication. Herbal medication is not ideal for the eye. It is very toxic to the eye.
Herbal medication is very toxic to the eye. See, when you want to travel, you have someone advertising eye drop. They say when you put it, all your problems are solved. You can even see into 2030. Don't buy. Trust me, those guys have sweet words. I know someone that can pound pineapple something and squeeze the water and put. Don't see. Go to an optometrist because I don't know. See, eyes. It's better. Nothing is. Anyways, let's just move to our next conversation. We are still talking about myth. What are some of the myths that you have heard in your years of practice, Dr. Jimmy, that you would like to debunk for us on this honorable floor? Things that people have said, oh, this and this and this works, but in essence, it doesn't really work.
Your eye begin to spoil. It's not true. Except and otherwise, you got a wrong prescription that is not yours. And if it's a wrong prescription, the moment you wait, you won't be comfortable. It can either be as if the ground is not balanced or the ground is far from you or it's coming very close to you. So one of the news that people should stay like the how would I put it, like one of the news that people should get their mind off or clear the hair is that glasses cannot spoil your eye if it's the right one for you. Because if your eye was that good, then there wouldn't have been need for glasses. But because you have an error that needs to be corrected, that is why the glasses was recommended for you. And I do tell people that glasses cannot actually change the normal state of your eye. You see, for people that are short-sighted, you see short-sighted people, you see long-sighted people. A short-sighted person is that the eyeball is too big. See, if the eyeball is too big, when light comes here, it will not get to the retina. The image will fall before the retina. So what the glasses does is to help to push the image to fall on the corresponding point of the eye. It does not change the original state of your eye. The glasses only correct your eye the moment you wear it. So once you take it off, your eye is the same way it has always been. Yes. Then you see some people say, my grandmother was 100 years, she was not using glasses. Check, do you think your grandmother was short-sighted? Because a short-sighted person is that even in their 100 years, people that are highly short-sighted, the short-sighted is that they can see well at near, but they cannot see well at far. So even in their 100 years, they will read something that is very, very tiny, but look at the person's side. They cannot recognize people at far until the person gets close to them. And also check the occupational aspect of our grandparents. Some of them were not so educated, so they didn't see need for glasses. They just go on with their eyes like that. And you that just came into the world, and my grandmother was 100 years, she was not using glasses. What was the visual need? The person did not see need for glasses. And now you come to see other professions like lawyers. Some lawyers, before they even get to their 40s, they start using glasses that will help to maximize letters because of their visual needs. And they do more of writing. So they need something that will make the letters to be clear and detailed. The visual need of a farmer cannot be that compared to that of a teacher. A farmer would not have need for glasses. Same thing with let's say maybe a local apprentice that does not have to do with either writing or any form of literacy needs. People do say that when you go to hospital for surgery, they will go and spoil your eye, and that's been the beginning of your problem. It is not always so. It's not in all cases. Because number one, in cases of cataract, someone go for cataract surgery. Then after the surgery, realize that the person is not seeing. Probably before the maturation of the cataract, the person already has retinal problem. See, if the person has a retinal problem, there's any problem at the back of the eye, it will influence the outcome of a surgery. Imagine someone that has glaucoma going for cataract surgery. So after the surgery, the chances of the vision coming back in full how it's supposed to be is going to be very, very slim because the optic nerve is already compromised. Okay. Then secondly, poor post-operative care. A surgeon will do everything to bring back your vision, but when you go home, you do not go in line with the guidelines that was given to you. We are going to catch out operation for a patient. After the surgery, mama came back a week. What happened? She fell down. So when she fell down, the lens shifted. That was just the beginning of her problem. So you have to take her back to the theater for repositioning and all that. So these are the things that people now begin to say, when my mama went for surgery, everything is false. No. Most time, for example, if for people that do operation, we mostly give them guidelines. During the period of your healing, there are things you don't chew meat that are hard, you do not sleep on the side of the operated eye, you do not bathe, you do not shave, you do not comb your hair, because at that point, if you do any of those things, they can predispose the eye to infection. But when people go, they do otherwise, and when the eye gets infected, they come back to the hospital.
Okay, so you've heard for yourself myths about the eyes that are not really true. I know somebody said something. She said that one day she was just making her hair and somebody walked up to her and said, "Oh my God, you have fine hair." And she slept and she woke up and she started having eye problem. Eye problems are not spiritual problems. It starts by giving you signals: headache, burning sensation, teary eyes, red eyes. When you see it, don't go and put your face inside water. You know, I had a friend that used to do something very crazy. When her eyes hurt, she'll pick a basin of water, she'll drop eye drop, and then she'll soak her face inside the water. God forgive. We did lots of crazy things though, but these are myths. When you go have any eye issue, walk up to the hospital. I'm not saying buy the drugs that will be recommended, but talk to an optometrist or an eye doctor. They will help you. I don't have time. Would have talked about the use of contact lenses. But before you use any contact lens, make sure that it's recommended by an eye doctor, or you've had a conversation with an eye doctor before you decide to use contact lens for beauty. You see, some people do a whole lot. You buy contact lens from, forgive me, but Plaza, right? And then you carry it and place in your eyes. I mean, those things could destroy your eyes, for eternity. So please be very, very careful. Avoid playing with the eyes. Even when you're trying to do your eyelashes, you have to be extremely careful, because one drop of a wrong gum, guys, you could, come down with a condition that is inexplainable. And that's to say that we've come to the end of our show today. I love you so much. And you know that the eyes is so important. Without the eyes, you will not just be seeing me right now. So please take care of the eyes. If you want to do a catch-up, maybe we're too fast for you and you want to catch up, go to our page on Facebook at Spectrum TV, Spectrum TV Live, or you can go to our website at www.spectrumtvlive.ng and you get the catch-up both from the first edition to now. I love you so much. My name is Geraldine James. Please take care of your eyes, avoid playing with it, and see an eye doctor before you receive any treatment. Avoid herbal treatment for any reason. Don't mind anybody that will tell you they know somebody in Lagos. Is a lie. Bye-bye.